I think the COVID-19 pandemic can definitely cause PTSD for some people. My name is Kimberly Chew, and I'm a psychologist and also the clinic manager at Annabelle Psychology. I personally have been at Annabelle Psychology for about just over 1.5 years now, and in total, I've been practicing for about 7 years.
Currently, what are the perceptions of mental health issues and treatments in Asia? Are they still considered very conservative?
This is an interesting question that I think I've actually been asked quite a few times, really. I personally believe that with a lot of efforts made to educate the public about mental illness, there's definitely been a positive shift in attitudes in recent years towards mental health. So I think that this is really evident in the number of people who are coming forward now to seek professional help for mental health issues. However, of course, there are some perceptions that continue to be conservative in nature, and stigma, I feel, continues to exist in Singapore surrounding mental illness. So there are several main beliefs that prevent people from coming forward or being open to mental health issues and treatment, and these would include things like, perhaps some people think that mental illness is not a real condition. Individuals with mental health conditions might be perceived as just being dramatic or weak, and that their issues might not warrant treatment. So at the same time, there's a great deal of fear as well towards people with mental health issues due to the belief that they are dangerous or that they will harm themselves or other people around them. And this belief, I feel, is likely to be the result of factors such as interpersonal influences, local cultural values, and of course the negative portrayal of individuals with mental health issues in popular culture. But overall, I feel over the years there has definitely been a shift, and it's heading in a good direction.
I think that's very good to hear that this whole issue of mental health is slowly pointing towards the right direction, where people are starting to come out to get help. Yeah, I think it's very good. What are some words that you would like to speak to people who may be suffering from mental health but are afraid of coming out to get treatment, or maybe not just themselves or also their loved ones?
I think definitely there are a lot of things to look out for. So if, say, for example, a person that you care about or your loved one is suddenly demonstrating a dramatic shift in mood, or is having difficulties with functioning and has really maybe been having some pretty unusual thoughts, or maybe along the lines of like suicidal thoughts, I think these are definitely red flags to take note of. And if you do notice this in a person that you care about, or in a partner or in a family member, it would be advisable to encourage them to seek professional help. And like what I mentioned, there is a lot of stigma around coming forward to seek help or see a psychologist or see a psychiatrist or any other mental health professional. However, I would encourage you to give it a shot. I understand that this is difficult, and I understand that that this is something that is probably very unusual and very out of your comfort zone. However, I would encourage you to talk to somebody and allow that person, so allow the psychologist perhaps to talk you through what they can do to help you, and also to kind of allow them to answer your questions, or put at ease any concerns or worries that you might have about seeing a psychologist. So I would definitely strongly encourage that.
So how has this COVID-19 pandemic impacted the mental health of people all around the world, as well as in Singapore and Asia?
It has been a strange couple of months, or year in fact, and I think that COVID-19 and this current pandemic has had a huge impact on mental health, not only for people in Singapore, but all over the world. I think now more so than ever, it is a time to kind of raise awareness about this, and that people should start to prioritize or take note of their mental health. So COVID-19 has been extremely unpredictable and really isolating for a lot of people all over the world. So of course, with here in Singapore, circuit breaker, and overseas, some countries experiencing multiple lockdowns. So this has kind of really given rise to many mental health issues, ranging from anxiety to depression, and sometimes really extreme feelings of loneliness for people.
Do you think this COVID-19 pandemic can actually cause PTSD in people?
From my own personal experience in private practice and working with a lot of people here in Singapore, the answer would be yes. So absolutely, I think that COVID-19 and the COVID-19 pandemic can definitely cause PTSD for some people. And this would involve specifically people like frontline workers, or individuals who unexpectedly lose a loved one because of COVID-19, or having COVID-19 yourself can be traumatizing and can lead to PTSD.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.